For many of you who are struggling with your weight, the pandemic is wreaking havoc with your health. It's not uncommon to hear that some people have gained 15, 30, or even 50 pounds. A recent study sponsored by the American Psychological Association's Stress in America poll found that 42% of Americans gained more weight than intended over the past 12 months. On average, they put on 29 pounds. 1 in 10 of these people gained more than 50 pounds. It was much higher for men at 37 and lower for women at 22. Conversely, only 18% of people in this poll lost weight, on average of about 26 pounds. As I thought about what this means in terms of worsening sleep apnea, a study came to mind that came out of the Wisconsin sleep cohort, which showed that for every 10% of body weight you gain, the severity of your sleep apnea score increases 32%. This gives you a 600% increased risk of going into the moderate to severe sleep apnea category. So what happens is this significantly raises your risk of high blood pressure, diabetes, heart disease, heart attack, stroke, dementia, and sudden death. Not to mention all the other problems of being severely overweight, such as poor sleep, being unable to exercise, joint pains and aches, skin problems, and lack of self-confidence or self-esteem. If you do the calculation, a 37-pound weight gain for an average man of 200 pounds is 18.5%, which is almost 20%. Here's another shocker for you. In that same Wisconsin sleep cohort study, a 20% increase in your body weight raises your risk of developing moderate to severe sleep apnea by 3,700%. This may sound depressing, but on the flip side, about half the people lost weight compared to the weight gain group, so it probably lessens the overall severity somewhat, but it's still not good news. Now that we know that obesity is a major independent risk factor for bad outcomes with COVID infections, this is an issue that needs to be addressed urgently. Even if you escape a COVID infection or complications from being infected, you still have a much higher risk of all the bad things I mentioned earlier. Having sleep apnea by itself was also an independent risk factor for bad COVID outcomes. This is why, if you're severely overweight, it's important to get tested and treated for sleep apnea. The most common way of treating sleep apnea is using a positive pressure mask to sleep with at night, called CPAP or continuous positive airway pressure. The one caveat with CPAP is that in some people, it can actually cause more weight gain. So this is an issue that needs to be monitored closely once you start to sleep better with CPAP. In my next episode, I'll cover some of the common myths and even lies that doctors perpetuate about how to lose weight. If you found this video helpful in any way, please click the thumbs up button below and subscribe to my channel. This way, you can stay up to date on the latest ways to breathe better and sleep better so that you can lose weight and look and feel much better. Until next time, bye-bye.